Sanibonani Mzansi, Dumelang. Welcome to another episode of The Health Club, proudly brought to you by GEMS, the Government Employees Medical Scheme. I'm your host, Clement Manyatela. Today, we're having a conversation that's urgent. It's uncomfortable for some, but it's absolutely necessary. It's about reproductive and sexual health. Teen pregnancy, HIV, stigma, coercion, these are not just headlines or hashtags. They are real issues affecting young people, families, and futures every single day in South Africa. We're in a country where silence around sex and health has cost lives, but silence ends here. In this episode, we're talking about consent, prevention, power, and the right to protect your body and your choices. Whether you're a parent, a teenager, or someone just trying to understand your options, today is about truth. It's about clarity and taking control of your health with confidence and not shame.
That we also need to build a culture where caregivers are comfortable to talk about sexuality in the home.
I tested and the test came out positive. I felt like dying, okay?
What inspired me to start taking PrEP was the fact that I got exposed to HIV.
Before we get into the studio discussion, we want to start with a story that brings this topic home. Umpimetse became a mother at 16, and her journey shows us the real-life impact of teen pregnancy far beyond the clinic or the classroom. Take a look at this, and we'll be back after the break.
My name is Atlhang Umpimetse Mphahlele. I am from a small village called Taung in the northwest. So when I first found out that I'm pregnant, I think I was doing my grade 11. That was back then in 2021. I tested and the test came out positive. I felt like dying, okay? I felt like the world was coming to an end. I'm like, okay, is this me? The first thing that went through my mind, what was society gonna say? What are my peers gonna say? What is my boyfriend gonna say? Oh, my mom, my dad. 3 months down the line, my pregnancy, my baby daddy left me. I had thoughts of killing myself. I had thoughts of killing my baby. I had thoughts of dropping out from school. So it affected me a lot. So at first, my family was disappointed in me. My mom was even crying. My mom was crying. My dad did not come home for about 2 weeks. I'm from an unstable household. Yeah, my mom was abused, is still being abused. She's still being abused. My dad is bipolar, so I literally had nobody to talk to, I'm doing everything for myself and my son. My dad wants nothing to do with me. I'm trying my level best to protect my son from everything, I even took him to avoid the traumas, drama, my father's drama, the dysfunctional household, the favoritism that was happening at home. So he's currently struggling with speech, delay of speech. He can't speak. So I think that affected him. But in a nutshell, he's a bubbly child. He's a bubbly child. But I wish I would have known back then as a teenager is to be open with my mom about birth control methods, acknowledge that I'm sexually active and prevent me from being pregnant, and being selfish with my womb, being selfish with myself,
Welcome back to The Health Club, proudly brought to you by GEMS. You've just heard Umpimetse's story, a reminder that reproductive health isn't just a policy issue, it's actually a human one. And these stories are far from common than we realize. Joining me in studio today are two remarkable women who've been on the front lines of this work. We've got Dr. Shahida Omar from the Teddy Bear Foundation, who spent years advocating for young people, especially those affected by abuse and trauma. We're also joined by Professor Helen Rees, who's the Executive Director at VET's Reproductive Health and HIV Institute, a leading voice in public health, HIV prevention, and reproductive rights. Thank you to both of you for making time for us.
Thank you.
Maybe let's start at the heart of it, Dr. Omar. Why do we still see so many teen pregnancies?
I think what we need to understand that this phenomenon of child pregnancies, Clement, a child, it's a child. A person under the age of 12 and 16 is not teenagers, they are children. So children birthing children. This phenomenon is rooted in deep social injustices in society, and children are falling through the cracks because they do not have access to opportunities for education, awareness, and also access to proper health care. If we just look at the realities where children, if we look at the Sexual Offences Act sections 15 and 16, which were amended because of the injustices it caused to children, where children were reported if they were engaging in any form of intimacy. And so the fear of reprisal, the fear of stigma, the fear of being judged has prevented children from going forward, seeking counseling, seeking support, and making positive, informed choices at the end of the day. And also the reality of the comprehensive sexuality education, that there's been a huge ruckus and outcry a few years ago where parents didn't want their children to be exposed to that kind of information. But I think we also need to be aware of the fact that sex and sexuality is a taboo subject. It's not something that is engaged with, discussed at home. In all the research that we've conducted at our foundation, we have found from the children themselves that they've had to reach out to their peers, to the internet, and they would have preferred to receive that information from their caretakers, their parents, their guardians, unfortunately.
Isn't that the problem, Professor Rees, in that these children end up now listening to their teenage friends? So even though the sexual education that may be provided, but in the homes the conversations are not happening as much as they should be. Where do you think the challenge is in as far as sexual education is concerned, and who do these children even trust with information like that?
Well, I mean, there have been many studies that look at different groups in our population generally, in different age groups, and say, who do people listen to? And in that age group, listening primarily to, say, doctors or nurses, partly because there isn't access. I mean, young people who are fit and well don't go to clinics. They're not going to go to healthcare workers. So the group that become very important are actually family and friends. So when we think about who the messenger is, particularly in the teenagers, the messengers are friends. They are much more the peer group. But I also agree with you that we also need to build a culture where caregivers are comfortable to talk about sexuality in the home.
What do you think we need to do differently as different stakeholders, whether it's communities, families, the government, various institutions, in how we teach young people about sexual health and even issues like consent?
Because we are obviously worried about social media and young people, but there's an opportunity there, huge opportunity, which we've been using extensively in the work that we've been doing with young people, with teenagers, both in clinics and in schools. And those opportunities are things like, what social media platforms do you like? Do you like apps? Let's use those. And we've used those extensively to get messages out in a platform that is understood and accepted by young people.
Yeah, and still on that, Professor Rees, I wonder, PrEP, for instance, do the people know about this? Is awareness there? And two, is it even easily accessible?
Well, we've been supporting the Department of Health with a very large national program that's been rolling out PrEP. And for people who don't know, it stands for pre-exposure prophylaxis. It's a mouthful, but what it is are tablets and now injections that have been developed successfully to stop HIV infection. The problem at the moment with the tablets that are available is that it's a daily tablet. And we know from contraception that it's not easy to take and to remember to take a tablet every day. So we're now quite excited about the prospect of this new generation of PrEP products, as we call them. We're going to soon have, we very much hope, an injection that can be given twice a year, which is almost 100% effective at preventing HIV. I mean, that's going to transform HIV prevention. But we first have to be able to afford it, and then we have to be able to roll it out.
Yeah. Dr. Amar, someone may be watching us now and they're thinking, how do I even start this conversation about sexual health, conversation about consent? I mean, we still have families that are so conservative. They don't want to talk about sex, especially when you are still young, when you are still a teen. What advice do you give, one, parents out there, but also two, young people, so that they can also be armed with information and be protected?
Well, I think it's important to understand that there are organizations like the Teddy Bear Foundation, there's Childline. These are platforms where parents and children can access support, any questions, concerns, confusions, and even trauma if they've been subjected to it. Because as Professor Rees spoke about online exposure, we see a lot of harmful sexual behavior because of the online exploitation or exposure they've been subjected to. So we appeal to all people out there, seek support from mental health professionals. It's at no cost.
Are we talking to young men, Professor Rees? Because sometimes when we talk about sexual, issues of sexual health and sexual education, normally the focus is on young or women because they're the ones that will fall pregnant. But they're not impregnating themselves. So how much work is being done to get young men out there to understand their responsibility as well, and not just the risks associated with this?
We've had an extensive schools program in 7 provinces. Sadly, the funding for that was cut off with these recent US aid cuts. But in that program, where we were also offering PrEP to sexually active school-going children who wanted it, young people, young men would, although the initial emphasis was for young women, young men were starting to say, yep, we want it too.
Yeah.
But also in the community, men who have sex with men community, they're also very, very strong on taking up PrEP products. So the answer is yes, we are talking to young men. Do we need to do it much more? We do.
Yeah.
And one of the worries, because of all of the funding crisis that are affecting different organizations, is that those organizations that have been focusing particularly on young men might well be affected by reduced funding.
And speaking of PrEP and, of course, young people, sexual health isn't just about preventing pregnancy. It's also about protecting yourself from infections like HIV, and doing so without fear or shame. Here's Phumlani Kango, a young activist who made a choice many still shy away from talking about. He's on PrEP, and here's why.
Hi, my name is Phumlani Kango, and I am a PrEP advocate, and I'm about to take my tablet. So what inspired me to start taking PrEP was the fact that I got exposed to HIV. So I had an incident where someone removed a condom while we were busy engaging in intercourse, which is known as stealthing. So after that, I had to get on post-exposure, which is the opposite of PrEP. So I had to stay on that for 28 days. So while I was on post-exposure, one of the nurses at the clinic I went to mentioned PrEP as something that I need to consider, considering my lifestyle. You obviously have to first get tested. You have to get tested for HIV to see if you're negative or not. And then after that, that is followed by drawing of your bloods. So that is to check for your kidney functions and to check for any other diseases that you might possibly have that might not have been, that might actually affect your liver, such as hepatitis. And then after that, they administer you 1 month, and then you come back after a month, you get tested again, and then they'll give you 3 months, and then you come back every 3 months to get tested, and that's for the oral PrEP. And then for injectable PrEP, you get 1 injection every 8 weeks. people basically assuming that just because you're on PrEP, it means now you're not going to use other forms of prevention such as condoms. So people automatically assume that just because you're on PrEP, you're now being someone who's being promiscuous, you're obviously now leading a different lifestyle. A lot more people are open to talking about HIV, which is number one, because obviously back in the day there was a lot of stigma regarding HIV, so people didn't talk about HIV, they didn't talk about treatment. So now with PrEP, people are much more open when it comes to talking about preventing HIV. Being on PrEP allows me that freedom and safety, knowing that I'm secure whether or not the other person takes care of themselves or not.
So that was Pumlani, and his story is powerful because it shows what it looks like when someone takes control of their health, despite stigma and silence. But for many young people, PrEP is still misunderstood or even judged. Professor Rees, you spoke earlier about the accessibility of PrEP. For young people watching us and are saying, I actually think that this could work for me, I want to give it a try. Where do they go?
Well, there are Department of Health clinics that are providing PrEP, and particularly providing the pills. But in the future, we're very much hoping, as I say, we can get injections. We've done lots of studies asking young people, what would you like? I mean, do you want a daily pill? Would you rather have an injectable? And the answer is, we would prefer an injection, thank you, because it's easier for us to remember, and it's twice a year, or even there's another one that's every 2 months. That's what we would like. And that's why I'm saying we're looking at, other platforms like apps, where you can do Q&A, where young people can ask a question, get an answer using artificial intelligence. That's what our aim is. But we do need to get PrEP into the community, and young people are at high risk.
Are we finding young people where they are and not where we wish they were? Professor Rees spoke about social media because that's where they're playing at, Dr. Omar. So where are the places? Are we speaking to them in the places where they are and where they are comfortable to be vulnerable and ask questions?
So we're using a lot of Snapchat, your Instagram, your Facebook, your TikTok, where children have access, where children are engaging, because we know, if we look at the statistics, 70% of children are using devices, even if they don't possess one of their own. They are utilizing friends, families, parents' devices.
Professor Rees and Dr. Omar, thank you so much for joining us for such an important conversation.
Thank
you very
you
much
for allowing us this opportunity.
Thank you.
We'll continue the conversation in just a moment, including some of the innovations helping make sexual health care easier to access and less intimidating. Don't go anywhere. The Health Club returns after this. Welcome back to the Health Club, proudly brought to you by GEMS. Once again, thank you to our guests who gave us such powerful insights in the last segment. Now, as we continue unpacking sexual health and prevention, we turn our focus on innovation and how new technology is helping us reach more people faster and smarter. Public health expert Rudy de Korker explains how tools like mobile platforms and digital clinics are changing the game when it comes to HIV prevention.
My name is Rudy de Korker. I'm a public health specialist and also a PhD candidate at Stellenbosch University at the Africa Center for Inclusive Health Management. One of the challenges that we face within HIV management would be the adherence management, and we trust that through the assistance of telemedicine, we would be able to have better adherence management as we move forward. My research is then focused on looking at the perceived effectiveness of telemedicine, innovative interventions or innovations in South Africa for HIV would be the long-acting injectable PrEP, but then also telemedicine is really taking off in South Africa, especially in HIV. The digital platforms that are available would then be able to ensure that individuals requiring PrEP would be able to then make contact with a healthcare provider on a digital platform and then be able to then receive the required medication based on the discretion of the healthcare professional, like the doctor, that would be prescribing that specific medication. There are various platforms available at the moment, especially in South Africa. When we're looking at education, these platforms make it accessible for especially young people, when we're especially looking at adolescent girls and young women, that they can actually then write blog posts, which are then posted on these platforms to then show their life experiences, but then also there are medical professionals who then have the opportunity to also share the clinical information with regard to PrEP on the platforms. The message to policymakers in South Africa with regard to innovation in especially telemedicine and HIV management would be that we require improved internet connectivity across the country to then ensure that our rural communities would be able to have access to these telemedicine platforms which have been made available.
What we've just heard from Rudy shows us how innovation is making sexual health care more accessible. But access only matters if people know that it exists. This episode is important because these issues touch on many lives, from HIV prevention to teenage pregnancy and everything in between. These are real, everyday challenges for South Africans. The good news is, support is available. Medical schemes like GEMS offer extensive programs from HIV testing and PrEP to STI treatment, counseling and support for young people facing unplanned pregnancies. So don't wait for a crisis. Help is there and it's yours to use. Let's take a look now at what GEMS is doing to make that help real in this week's GEMS News.
Welcome to GEMS News. In this edition, we explore reproductive and sexual health. Your reproductive and sexual health are key components of your overall well-being. Regular checkups, family planning advice, sexually transmitted infection screenings, and access to contraception are vital health services. GEMS ensures that members have access to these crucial health benefits, supporting you in making informed choices and maintaining a healthy life. Make reproductive and sexual health a priority and talk openly with your healthcare provider about any concerns you may have. Your health matters. For more information, visit the GEMS website or contact us through our social media channels.
And that's where we leave it for today on the Health Club. Thank you to Dr. Shahida Omar for helping us understand the deeper issues behind teen pregnancy, and to Professor Helen Rees for showing us how prevention, like PrEP, is changing lives. We also heard from Phimetse, who reminded us how early motherhood reshapes a young life. Phumlani Kango, who showed us that protecting your health is an act of self-respect. And of course, Rudy de Koker, who highlighted how innovation is making sexual health care more accessible than ever. If you're on GEMS or any other medical scheme, remember, support is there, from HIV prevention to counseling and reproductive care. These services are made for you. I'm Clement Manyatela, and this has been the Health Club. Stay informed, stay healthy, and join us online for more. We're on YouTube, Instagram, and Facebook. Till next time, take care.